In this video, we'll be discussing quickly what is the significance of this score and what are the parameters which we do. This is CHA2DS2 VASc score. Okay, we call it as CHA2DS2 score in simple words. So where it is used in a case of atrial fibrillation or AF, these patients with atrial fibrillation or atrial flutter, they are prone to develop cardiac thrombi, right? Cardiac thrombi, which later leads to cardiac thromboembolism. So they need very importantly long-term anticoagulation. So in which patient should we prescribe a long-term anticoagulation? The problem with long-term anticoagulation is it is prone for its own adverse side effects of bleeding, right? We have to decide based on this important score called CHA2DS2 VASc score. So what are these parameters? I'll tell you. C starts with congenital heart failure, or we'll call it as left ventricular failure or dysfunction, wherein you will see ejection fraction less than 40%. This is first parameter. And what is the score we give here? Score is 1. Now the second is H. H is again hypertension. So as per the latest guidelines, hypertension guidelines, it is BP more than 130 or more than 80 systolic and diastolic. Even if the patient is on antihypertensive therapy, still you classify him as an anti-hypertensive patient and you give a score of 1 here. Then A. A is age, and age here is more than 75 years. More than or equal to. If the age of the patient is 75 also, you will take a score of 2. So that's the importance of this suffix. Okay, it's the factor is multiplied. You have a double the score now. Score is 2. That's the reason CHA2. Next is D, wherein one more important uh, comorbid condition, that is diabetes mellitus, wherein you give a score of 1. Then S is either stroke or any transient ischemic attack or any history of embolism in the past. Okay, emboli. All these will get a score of 2 again, right? Because a patient who already had a thromboembolic episode, he has high chances of getting another attack. So the score is 2 here. These two are very important because in the recent past, in the medical PG entrance examinations, they were asking you to calculate the score based on the parameters given, right? So that's why it's very important. Now on top of that, in the new classification they have added 3 more parameters. Okay, one is vascular disease. So what kind of vascular disease? Any past history of or any prior MI or peripheral arterial disease per se, or presence of atherosclerotic plaque or aortic plaque. Okay, in the aortic plaque. If there is any history or prior history of this, there will be a score again of 1. Now next A is again age, but here age parameter is between 65 to 74 years. So you have to be very careful here. If it is 75, then you have to give a parameter of 2. Okay. So if it is in between 65 to 74 years, you will be giving a parameter of 1. Now SC means sex category. Female sex has highest risk. So if there is a female patient, you give one more score 1. So score 1, 1, 1. So overall, if you calculate how many parameters do you have? 5 plus 8 parameters. Okay, and the total score here is near to 10. Okay, and based on the score, you have, let's look at the score and also expected risk of stroke. Okay, risk of stroke based on the score. If the score is 0, so estimated risk of stroke in the future, that is annual, you are calculating on an annual basis the stroke risk, it is 0 again. If the score is in the range of 1, the risk is 1.3%. Okay, the patient has chance of getting a stroke in the near future in 1 year, the risk is 1.3%. If the score is 2, it is 2.2%. So if the score is 3, then the risk is 3.2%. And if the score is 4, then the risk is 4.0%. And if the score is 5, then it is 6.7%. If the score is more than or equal to 6 till the end, the risk is more than 9%. It changes. If the score is 7, it will be around 10.2. If the score is 8, it will be around 12.7. So overall, just remember that if the score is more than or equal to 6, then the score annual risk of stroke will be more than 9%. Okay, as you can see, yes, there is definitely, as the score increases, the chances or risk of stroke is increasing. So that's why the treatment recommendation will change based on the score. If the CHA2DS2 score is 0, no need to give any treatment. Okay, or no need to give any prophylactic anticoagulant. If the score is 1, you can at least give an aspirin, or you can even try any of the oral anticoagulant, or it's okay not to be treated because the risk is only 1%. But if the score is more than 1, that means starting from 2, any score after 2, you have to put the patient on oral anticoagulants. So prophylaxis should be started in this patient. Okay, risk versus benefit ratio, because risk is high. So this is how you use this score called CHA2DS2 VASc score to assess the risk of stroke in a patient with atrial fibrillation, and based on the score you will decide how to prescribe what drug to be prescribed for long term therapy.